Hi, I'm Stephanie, and my project was done on stem cell therapy to cure Hodgkin's lymphoma. I chose to focus on the ability to cure Hodgkin's lymphoma with stem cell therapy because I have a friend who's had Hodgkin's lymphoma relapse 3 times. Watching him go through the aggressive chemo and radiation treatments made me wonder if there was a better way to treat this disease. Stem cell therapy has had a stigma towards it by how the stem cells used to be collected. Hodgkin lymphoma has had several improvements in curing the cancer by using stem cell therapy. Stem cell therapy is very expensive, though, and won't be able to benefit people without some sort of financial help. Stem cell therapy is a relatively new way of treating medical problems. It has many different applications, but is still being tested before it can be a widespread cure. Development in the ability of harvesting and transplanting stem cells have made this type of therapy a less damaging cure and relatively easy. The main group I focused on was anyone that had Hodgkin's lymphoma, especially males. But this type of cancer is widespread and happens in men more than women, so it's easier to find cases involving men. It usually affects men in between the age of 20 to 35. Stem cell therapy has been successful in prolonging life in the patient, if not completely causing the cancer to go into remission. Both of the case studies focus on using stem cells to cure or make HL, Hodgkin's lymphoma, go into remission. They proved that to do that, a patient is needed to be given multiple transplants of stem cells. The first case study is about a 3-year-old in Japan, and was one of the first times it was used on a child. The other study is when a random group of people were given transplants when traditional means of curing the cancer didn't work. The first case study, like I stated, was a 3-year-old boy in Japan who was diagnosed with Hodgkin's lymphoma. He was given multiple transplants of stem cells, but he died even though his life was extended to 500 days after the diagnosis. After he relapsed from his first treatment of chemo, 2 months later, they gave him the first transplant, and he needed a total of 4 transplants. As stated above, the child's life was extended even though he ended up passing away later from complications from the Hodgkin's lymphoma. The stem cell therapy of transplants worked even though the child passed away. Some of the limitations are there was only 1 patient, and the subject died after the transplants and were not able to observe if there were any negative effects from the therapy later on in life. If you look to the left picture on your screen, you can see his lungs with white masses and tumors in it. If you look to and that was before he had the stem cell therapy. If you look to the right picture, you notice his lungs are a lot clearer, and this is after the stem cell therapy. The second study was on patients who had relapsed Hodgkin's lymphoma after they had chemotherapy. They were then ranked to their sensitivity of chemo. They took 37 patients and treated them with either allogeneic or allogenic transplant, depending on which one suited them best. The treatment lasted for 120 days and only had a 10% mortality rate. Stem transplant worked statistically better and was more effective of the first few years after the transplant and decreased to a 75% life expectancy after the first 4 years. Limitations is that the randomly selected study was only done once and has not been repeated since. Another limitation is that it was done in 2010 and our technology has greatly improved since then, so transplants are not as dangerous and stem cells are easier to get without causing ethical problems. If you look at the graph that we have, if you notice the one side says probability of surviving and the bottom is years post-transplantation, you notice when it first happens they have about 100% surviving rate, and it decreases until about 4 years after the transplant and drops to about 75%. Based on what information I found, stem cell therapy is a good alternative to cure Hodgkin's lymphoma over chemo or radiation. As stem cell research and therapy progress, the technology will get better along with the procedures, which should help more people to be able to turn to this cure and afford it. As this becomes more widespread, It can give people another choice for what type of cure they want to put their Hodgkin's lymphoma in remission. It's always better to have more options during a time when the only current treatments are so damaging. One of my group members did osteoarthritis, and the obstacles were time, the insurance companies not supporting or paying for the treatment until a certain amount of studies were completed with a 95% success rate. Another was varicose veins, and it was done on rats in Siberia, and Russia's law won't permit human trials, so the law needs to be changed to allow that. Next was heart failure, which has the issues of cost, availability, and lack of research. The last one is tissue regeneration on burn victims, and it ran into the problems of having people that have liposuction to donate their adipose tissue, which has stem cells, to be used to help the burn victims. We all agreed that funds were an issue along with the ability to get enough stem cells for the therapy. Ethical implications. One of the solutions I came up with is the education of the public about how we acquire stem cells that don't require aborted fetuses, which most people believe, and how it first started. Another would be having government funding to be able to do more studies and make it a common medical practice. Insurance companies also be brought on board to help with the cost. Also, donation of stem cells need to be easier and readily available, such as making stem cell facilities that can collect stem cells like blood donation places collect blood. Also, women can donate or sell their placentas after birth, since they are full of unused stem cells that were created as the baby is being formed. And since most women just throw their placentas away, it's a better use of that. We need more studies done to get rid of the stigma that stem cell therapy has, since the cells can be gathered by several different ways without causing death or damage to someone or something. Thank you very much.